Since I last remember, I've always been in and out of the clinic, hospitals for many things. I started having fevers constantly, rashes all over my body. When I turned 10 was when I was first diagnosed with Kawasaki disease. I have those flashbacks to this day of being really afraid.
Everything just was so unreal. I couldn't believe it was happening, but it was just happening. On the drive over there, I just remember praying, I'm like, God, please let her live. I ended up leaving that hospital without my daughter. She was gone.
And today I'm making gingerbread.
I needed help because I felt like I was gonna go crazy if I just kept everything inside. I was pregnant, I was dealing with this loss. I needed like a safe place, and the midwife that saw me was, really caring, concerned. They offered for me to see a therapist.
We serve that purpose. We're where patients and community members go when there's no one else to turn to, because that's what we do. We're the safety net for the community. Our job is to assure healthcare access for our patients, right? Regardless of their situation, their circumstance, their walk of life, whatever they may be contending with.
We have to be there to be able to support those patients. We're partners in the health of our community. As primary care providers, as a safety net, we're where patients go first.
What we're trying to do is promote and provide access to healthcare to the community, particularly those that need it the most, and trying to make it as easy as possible for folks to access care, reducing barriers and ensuring that folks have equal access to healthcare. That means taking care to neighborhoods, partnering with our community partners, and in bringing care and consolidating care to break down barriers so that they are able to come and seek care and meet with their providers one-on-one.
As a kid, it's kind of scary meeting a new doctor and whatnot.
My name is Dr. Curley. I'm a pediatrician. I've been with TrueCare for 20 years.
I see him as a role model. I smile a lot because I'm very thankful for him.
I feel a connection to him and his family, and still feel responsible for making sure that he gets the care that he needs even now.
I believe TrueCare couldn't be named anything else. It's what it stands for.
Adrian bringing his daughter to me, I call her my grand patient. To me, it's just an affirmation that I did a pretty good job, taking care of Adrian, so much so that he trusts me to take care of his little pride and joy. I feel like it's an honor to be able to take care of these kids, to make sure that that child grows up as healthy as possible.
The relationship is important because we can't do it alone. And we know that Adrian is only representative of one patient and one family. There are so many more like him. There are so many other individuals who are in crises. They represent what we stand for, what we come in day after day to make sure that everyone who we touch and come into contact with has a fair shot at life.
Once I started seeing the therapist, I just realized that, he started helping me process my grief. And I feel that I have woken up. I know there's hope that I get to see my children grow up, live a long, healthy life. I feel every town should have a TrueCare. It does feel like a family, and you don't get that everywhere. They just don't say it, they actually prove it with their actions. I'm very thankful for the care that I've received, and everybody that has put in their love in what they do.
oftentimes it's individuals who have no other option, no other place to go. And it's only part of what makes our work so critical. But I just feel so overwhelmed when I think about the number of lives that we've touched and the number of lives that have touched us too. We have this very long-standing history in our community, 50 years and counting. And TrueCare understands that by continuing to invest in the health of our patients, we're investing in the health of our communities. And together we can all rise. Together we can all build a better, brighter future. We're inviting our donors, our friends, our supporters to be a part of this next leg of our journey. Who will help us build a bridge for the future? Who will help us help our patients to get across to the other side?